everyone, welcome to another video. So in today's video we'll be looking at anorexia. So anorexia is also known as anorexia nervosa, and this anorexia is a serious mental health and eating disorder where a person has this intense fear of gaining weight and intense fear of having a distorted body image. So this leads them to eat very little or lose excessive weight, and sometimes engage in harmful behaviors like excessive exercise or vomiting after eating. So like vomiting after, it's like them inducing the vomiting. So despite being underweight, people with anorexia, they often believe they are overweight, and it is common. This condition is very common in teenagers and young women, but it can affect people of any age, any gender, or any kind of background. So if this anorexia is left untreated, it can lead to severe physical and emotional problems, including other organ damage, infertility, and even death. So this anorexia is not just about food. It's often linked to emotional and psychological issues such as having a low self-esteem, being a perfectionist, having a need to control everything, like you have to be in control of everything. Then societal pressure to be slim. If you have this, for example, if you have this group of friends that everybody is having that banging body, and you feel like you're the one that is one kind, so having this pressure kind of lead you to not be eating as frequently as you need to, not be eating well, just because you want to get to that stage that every other person is. So this anorexia, it can also coexist with other conditions like depression, anxiety, or obsessive compulsive disorder. So anorexia is classified as an eating disorder and a psychiatric illness. So it requires a multidisciplinary approach for treatment involving doctors, mental health professionals, dietitians, and pharmacists. So what exactly causes anorexia and what are the risk factors? So there is no single cause of anorexia. It is usually the result of a combination of biological and psychological and environmental factors. So for the biological factor, genetic predisposition, like having a family history of this condition, then hormonal imbalances, brain chemical imbalances, especially related to mood and appetite. Then psychological factors that can cause anorexia, like low self-confidence or body image, fear of being judged, desire for perfection or control. Then environmental factors like social or cultural pressure to be slim, then influence of media, social media, bullying or trauma, and then family stress or like just generally childhood experiences. So anorexia affects nearly every organ and system in the body due to malnutrition, like you're not having the right amount of nutrients you're meant to be getting on a daily because you're trying to maintain this particular shape, or you're trying not to go overboard. So it affects the body due to the malnutrition and due to the starvation. So to the heart, it causes a slow heart rate. It can cause low blood pressure and heart muscle shrinking. Then on the bones, it can cause osteoporosis, that is bone thinning, and there could be high risk of fractures. Then to the reproductive system, it could cause loss of menstrual periods in females, infertility. And then digestive system, like constipation, bloating, stomach pain. Then on the kidneys, dehydration, electrolyte imbalance. On the brain, trouble concentrating because you're not having enough food, trouble concentrating, confusion, depression, Then on the skin and the hair, you have a dry skin. You can have a dry skin, brittle nails, hair loss, and on the immune system, like, because you're not getting the adequate nutrients you're meant to get, of course you have a weakened immune system, and you'll be prone to frequent infections. So for the symptoms of anorexia, they can be physical, behavioral, and emotional. So for the physical signs, significant weight loss, fatigue and weakness, dizziness or fainting, feeling cold almost all the time, irregular or absent menstrual periods, slow heart rate, constipation or bloating, dry skin, hair loss. Then behavioral signs like avoiding meals or lying about eating, then cutting food into tiny pieces, obsessive calorie counting, like every meal you want to consume, you always have to check how many calories am I taking and all those things. Then excessive exercise, like even when you are tired or you are injured, you just feel like, oh, I need to exercise today. If I don't exercise, I cannot reach my goal of being if you are, let's say it's 50 kg you want to be now. I cannot reach my goal if I don't do this exercise this day. So excessive exercise, even when you know you are not feeling well or when you know you are tired. Then using laxatives or vomiting to lose weight. Then also social withdrawal or avoiding meals, like having meals with others when you're invited for a meal, like just giving flimsy excuse that you don't want to eat or something. Then emotional signs, like having a very intense fear of gaining weight, like if you like, for example, if you, let's say let me give an example now. The person is like 71 kg and they went to check, they are anorexic, then they went to check their weight, and out of nowhere they are 72 now, and just that little change will make them will make them want to scream. So this is an example, like having intense fear of gaining weight, even if it's just small weight. Then seeing yourself as fat despite being thin, because in your head you feel like you've not attained that perfect body that you're looking for. Then irritability, anxiety, depression, strong desire for control or perfection, and at the end of the day feeling worthless or ashamed, even though there's nothing wrong with you. Then diagnosis. So this anorexia is diagnosed based on medical history, including checking for the patient's feeding habits, weight changes and emotional states. Then physical examination, like looking for signs of malnutrition, organ impact. Then psychological assessments, like to evaluate the person's thinking patterns, self-image and mental health. Then laboratory tests may show that the person might have low blood sugar or protein level, electrolyte imbalance, especially with potassium. Then low thyroid hormones or sex hormones. Person might even have anemia, dehydration too. So a person is typically diagnosed with anorexia when they have extremely low body weight for their age and their height. Or that is the first one, having extremely low body weight. Then they have an intense fear of gaining weight. Then number 3, they have a distorted view of their body or extreme focus on their weight or their shape. So for treatment, the treatment of anorexia requires a team approach, usually involving number 1, nutritional rehabilitation, like gradual refeeding with a structured meal plan to restore the person's healthy weight. Then getting support from dietitians and nutritionists to educate and motivate the person to eat more. Then for psychological therapy, like there's cognitive behavioral therapy to change unhealthy thinking ways about eating and eating behaviors. Then family-based therapy, especially for teenagers, like getting support from their family. And then counseling for self-esteem, to improve self-esteem, improve body image and coping skills. Then for medical care, monitoring for complications like electrolyte imbalance, heart problems, or organ failure. And hospitalization may be needed for severe cases, or for those at risk of death. Then medication. So there's no specific drug to treat anorexia directly. However, antidepressants or anti-anxiety medications may be prescribed to treat the underlying mental health issue. So long-term management of anorexia focuses on preventing relapse, encouraging healthy relationships with food and body image, and providing the person with ongoing mental health support, and involving the family, the caregivers in the person's recovery, and also addressing underlying emotional issues. So recovering from anorexia is possible, but it can take months or even years, and relapses are very common because it's not easy for that person to change that thinking pattern. So in summary, anorexia is a serious eating disorder marked by extreme fear of gaining weight, distorted body image, and refusal to eat enough food that you need for your body to function well. And it can cause severe physical and emotional harm if it's not treated early. And management includes nutritional therapy, psychological support, and medical monitoring. So anorexia is not a good condition. It's a condition of the mind, if I should put it in simple terms. So that is all for this video. Thank you for watching, and I'll see you in the next video. Bye.